Well, good morning. I'm very honored to be here and to share my story with you. I've titled my story Hemophilia, Heartache, Humor, and Hope. I don't have any disclosures to share. So I've had several hemophilia roles, starting with being a sibling. I am also a patient. When I was about 16 years old, after having my wisdom teeth out and bleeding for over a month, it was discovered that my factor IX level was only 10%, and I was labeled a symptomatic carrier. I prefer mild hemophilia, but that's a big topic for a different day. So now I'm a mom of children with bleeding disorders, and that's been my most important and difficult role so far. Finally, I do try to be an advocate for those with hemophilia, especially in regard to hemophilia inhibitors and children with hemophilia that have been orphaned and are in need of forever families. So when I was born, my brother was already 3. And I don't really ever remember learning the word hemophilia. It was just a normal part of our lives. Growing up, my brother was the one I looked up to the most and the person who could irritate me more than anyone on the planet. When my parents had my brother, they were only 18 and 19 years old, and they had never heard the word hemophilia. Later, my mom was tested during a research study and found out that she was a carrier. We don't know any history prior to that, but we do suspect that my grandmother was a carrier. She always bruised a lot. Until my brother was 5 or 6, every time he had a bleed, he had to be hospitalized and he received cryoprecipitate. It was pretty normal to see him in pain, needing ice, ACE bandages, splints, casts, braces, crutches, or even in a wheelchair. When factor IX replacement therapy first became available, it relieved my parents and brother of the long hospitalizations. However, they still had to go in for infusions. When Jimmy had a bad bleed in the night and couldn't wait until morning, my mom would call our pediatrician, Dr. Zara, at home, and he would graciously get out of bed and meet us at the doctor's office, letting us in the side door to do his infusions. So many children with hemophilia in the 60s and 70s were held back from being physically active, but once we had factor, my parents decided to let my brother be as active as he wanted on the good days. You can see in the picture on the left that he already had some joint damage to his left knee from chronic bleeding. On the hard days, we improvised, playing games inside, watching TV, reading, or swimming in the living room carpeting. Like any other high school graduate, Jimmy was looking forward to his future, thinking about college, work, a family, and a happy life. 1 year after graduating from high school, Jimmy found out that he was HIV positive. He was just beginning his adult life. He was scared, and so he decided to try and ignore his diagnosis and focus on doing the things he wanted to. We definitely didn't talk about HIV. The photo on the left is a special memory for me. While on break from being counselors at Michigan's Camp Bold Eagle, which was the first summer camp for children with bleeding disorders, Jimmy and 2 of his friends came home to celebrate my dad's birthday. It was a special memory for me because they let me hang out with them all weekend. This was 1 year after Jimmy was diagnosed with HIV. He was still healthy and happy and living in denial. This was the last year that he worked at camp. Soon after that, he pulled away from the hemophilia community. He lived in fear that people would find out, given what was happening throughout the country. So we didn't talk about what was happening in our lives with anyone. No one could know. It was extremely isolating for me. So Jimmy just lived his life and ignored it. He bought himself a racing-style motorcycle, drove fast, taking long road trips, and he lived for the moment. So after 3 years of trying to ignore his HIV status, Jimmy started to get sick. He was coughing a lot and losing weight. By this time, he and I had purchased a house together, so I began nagging him to go to the doctor. But he waited and he waited until he could barely catch his breath. He ended up in the hospital on a ventilator, and the doctors said AIDS for the first time. While looking through old boxes for pictures for this presentation, I came across a legal pad that we used to communicate with him when he was on the ventilator. It was really hard to read a lot of what he had written, recalling his fears and his worries. But my brother always had a great sense of humor, and amazingly, even in the face of extreme fear and not able to talk, his humor still came out in his writing. These are just a few things he wrote that had me laughing through my tears. I don't know if you guys can read these, but the first one said, "I must look like a cyborg, half man, half machine." That was the first time I went in and saw him after he was in the ICU. And we lived together, and he wanted me to clean the house. So shortly before he came home, he said, "You've had enough time to tear the damn house down and put up the Taj Mahal. Clean your butt off, little woman." And then he wrote, "If they give me some new knees and ankles and an elbow, I could be the $6 million man." He had a lot of other funny things that he wrote. Some of them I wouldn't be able to share here. He was pretty sarcastic. So for me, dating was tricky. At this point, I wasn't at liberty to tell anyone that my brother had hemophilia, which complicated my ability to disclose my carrier status. I found out I was a carrier when I was 12 years old after telling my parents that I wanted to know. They already knew because of a study my family had participated in years before. They were just waiting for me to decide I was ready to know. So the closer I got to Dave, my boyfriend, the more and more I felt like I was keeping a giant secret from him. Finally, after dating Dave for a year, Jimmy was agreeable to let me share his hemophilia status with Dave so that I could share my carrier status with him. However, I still had a rather large secret that I was keeping. I still couldn't tell Dave that my brother had HIV. It was often difficult to try to explain to him why I was so protective of my big brother and worried about him so much, even if he had the least little sniffle. So back to Jimmy. After recovering from his illness, he went back to life with added medications that came along with trying to treat his struggling immune system. He got a full-time job at a bank and even worked a part-time job at a movie theater, too. He traveled and eventually married his girlfriend, Lisa. Lisa knew of Jimmy's health status, but they chose not to tell her parents because they were afraid they would reject him. So this is my family in 1993. It was that year that we began noticing that Jimmy was becoming easily confused about cognitive things that normally would be easy for him. Shortly after this family picture was taken, he was diagnosed with terminal brain cancer and given 6 months to 1 year to live. At this time, Jimmy and Lisa did decide to explain to her parents what was going on. They were naturally upset that they had been kept in the dark, but they did become supportive and they were helpful. So in October, 1 month after being diagnosed with brain cancer, Dave and I were headed out the door to go purchase wedding bands and then go to Jimmy and Lisa's house to ask Jimmy if we could get married in his living room so he could be Dave's best man and witness me getting married. Just as we were headed out the door, we got a phone call saying, "Come to Jimmy's house now." I knew before we arrived that he had lost his hard-fought battle. So 3 months later, my wedding day was bittersweet. I was marrying this wonderful man who had walked with me through so much pain, but I was missing my brother. We were putting our hope in the future. Jimmy had told Dave and I not to be afraid to have children. He said things are better, medications are safe now, and you can't even tell these kids have hemophilia anymore. We were excited to start our family. So we started our family quickly. Prior to delivering our baby boy, I became very concerned about bleeding after delivery. I requested that my hematologist and my high-risk OB meet prior to my delivery date. They worked in the same hospital, just 1 floor apart, so it seemed reasonable to me. But my OB refused. I also wanted to set up donor-specific blood from my dad, as we had just lost my brother a few months ago to AIDS. I was afraid I would need a blood transfusion. My doctor refused to sign the paperwork necessary for me to arrange it. He insisted that I didn't understand how the female body stopped bleeding after giving birth. I won't read all of this, but I did highlight the most important thing that he wrote in this letter that he sent to my hematologist and was kind enough to send a copy to me. He said, "Her condition is not a complicated one from the standpoint of management, but there is significant patient anxiety." I think he thought I was a little bit hysterical. So I delivered our son 3 weeks early, of course, when my hematologist was on vacation. He was born very quickly. I did have a dose of factor IX being pushed in while I was delivering him. After the delivery, my cord blood was sampled to check for hemophilia in our infant son. Although they weren't supposed to do anything invasive, they did do a heel stick in the nursery and it wouldn't stop bleeding. So we knew that night that he had hemophilia before any of the blood work came back. I received another dose of factor IX before leaving the hospital, and we headed home thinking all was well. By the first night, I knew I was bleeding too much. I was passing clots the size of a grapefruit. So Dave took me to the emergency room and they called my OB. He was convinced that I had anxiety for no reason, so they sent me home, and I continued to bleed for 6 more days. After passing out in the shower, my husband called the doctor, and without seeing him over the phone, he told him that I was suffering from postpartum depression and likely I wasn't eating enough. After 7 days of hemorrhaging, I insisted that my OB see me. When I walked in, my hemoglobin was 4, and I needed emergency surgery and 4 units of blood. My dad begged him to just put an IV in his arm and hook it up to me so that he could give me blood, but of course they wouldn't do that. I really felt that I had tried to advocate for myself, and I was written off as being unreasonably anxious about my condition simply because I was a woman, and women don't have hemophilia. I need a drink. So for the next 11 months, I slowly recovered from my blood loss, and we enjoyed raising our son. He was diagnosed with severe hemophilia B, but we felt confident that we could handle things with the new improved medication and the support of our family and the hemophilia community. One summer evening, Jamie wasn't feeling well. He was lethargic and running a fever, and he threw up several times. I got more worried and called our pediatrician, who, by the way, was Dr. Zara. So I called him at home. He was used to that from us. And described what was happening. And he said, well, he's probably just sick, but if you're really worried, bring him in first thing in the morning and I'll meet you there. So I called my mom and arranged for her to come over in the morning so I could get ready for the appointment. And my mom noticed when I was in the shower that his foot would start shaking and then it would stop. So when we arrived to the pediatrician's office, he examined him and we told him about the shaking foot, but he diagnosed him with the flu and was sending us home. As we were walking out the door, Jamie's foot started shaking again, and the pediatrician realized that he was having a seizure. So he sent us to the ER to be assessed. I called the hematology clinic to let them know that we were coming, and they met us in the emergency room, already suspecting that he had a head bleed. They quickly did a CT scan, and it was confirmed he indeed had a head bleed. Surgery ended up being the best option, so we sent our sweet baby with the surgeon and prayed for the best possible outcome. We were blessed that Jamie made a full recovery and was ready to come home from the hospital in 2 weeks. So 2 weeks after getting out of the hospital, we were blessed to celebrate his first birthday. We were infusing factor IX at home every day through his Broviac, and that was the plan for 30 days after leaving the hospital. The plan was after 1 month of treatments daily, we would start decreasing the frequency until we found a good prophylactic level. So we were starting to find our new normal. About a month after we began follow-up treatment for the head bleed, I was treating him at home and noticed that immediately after the infusion he had some red hives. I called the clinic and they had me bring him up, but by the time I got there, the hives had cleared up. So they suggested that I bring him to the clinic the following day for his infusion, and that decision probably saved his life. Immediately following his infusion, he had an anaphylactic reaction and his face started to swell and he was having difficulty breathing. They immediately intervened and gave him medications to counteract the reaction. Blood work was completed, and the result came back that he had developed an inhibitor. So within a few days, the decision was made that we would start immune tolerance therapy, an attempt to tolerize him to factor IX, hopefully eliminating the inhibitor and the allergic reaction, allowing the medication to work for him. So we spent the next 9 months going to the hospital every single day for long infusions of factor IX, pre-treating with Benadryl. On weekends and holidays, we were in the ER. Being there every day, we had a special room in the clinic and in the ER. It was a long 9 months, but if immune tolerance therapy worked and Jamie could do prophy someday, it would all be worth it. Unfortunately, Jamie had an episode of edema at the same time that our hematologist was at the World Congress in 1996, where she began to hear about boys with hemophilia B and inhibitors that were doing immune tolerance therapy and developing nephrotic syndrome. When she returned, Jamie's urine was immediately tested, and he also had developed this kidney damage. We immediately stopped all factor IX and began treating by using a bypassing agent, Novo-7, that wasn't approved by the FDA yet. The hospital could get the medication for him on a compassionate use basis, but we had to wait for his bleed to be life or limb threatening. Then he would be admitted to the hospital and receive treatment every 2 hours until the bleed was resolved. We spent a lot of time in the hospital. During all of this, we tried to live as normal a life as we could. We enrolled Jamie in Head Start and Gymboree, trying to help him socialize and gain balance and gross motor skills in a safe environment. We would take local trips, always to be close to a treatment center in case Jamie had a bleed. When he did bleed, we treated immediately with rest, ice, compression, and elevation, oftentimes ending up in the hospital for medication. But the heartache was taking its toll on our lives. We worried about Jamie's little body and what permanent damage was being done. We were at the hospital so much, I think Jamie thought the nurses and doctors were his relatives. And in some way, they did become our family. They were there to support us, and they were desperately searching for ways to help him. But every bleed he had was causing more and more damage to his joints. He had wanted to have more children. We had wanted to have more children, but we were afraid to have another child that could have hemophilia and develop an inhibitor and have to go through the same things that Jamie was going through. But eventually we moved forward and we decided to add to our family. The timing worked out beautifully. Shortly before our twin daughters were born, Novo-7 became FDA approved, and we were able to treat at home when Jamie got a bleed. It was a grueling schedule. We had to treat every 2 hours for several days, so we would set alarms and take turns getting up all night long. But it was much better than being in the hospital, and we could travel outside of Michigan now. So when Jamie was about 2 or 3 years old and we were going through all of the hospitalizations, he was granted a special wish by the Rainbow Connection in Michigan. He chose to go to Disney World, but he kept telling us he would go when he was 6. And we'd laugh and say, "Oh, we'll go before that. We're just waiting for your medicine to be approved." Well, obviously, he knew something we didn't. By the time the medication was approved and we had our girls and were ready to go, he was indeed 6 years old. When Jamie was quite little, his amazing social worker at Children's Hospital of Michigan in Detroit began getting groups of families with hemophilia together to support one another. She even put me in touch with 2 other moms that had boys with hemophilia B and inhibitors. Both of them were about an hour away from me, but in opposite directions. But it was an amazing feeling to know that others were going through the same types of issues and had the same fears as I did. One of the moms and I talked on the phone almost every single day. She and I also tried to get the kids together to play each month. We also got plugged into the Hemophilia Foundation of Michigan and Camp Bold Eagle. Having a supportive community has meant so much over the years. I really don't know how we would have gotten through everything without them. Feeling supported, understood, and loved made all the difference. When we went to drop Jamie off at camp the first year when he was 6 years old, I was pleasantly surprised that about half of the staff remembered my brother, and it was like leaving him with extended family. I wish that when I was younger, my family had stayed in touch with the community through all of Jimmy's difficulties. It would have been nice to have their support and understanding instead of feeling so alone and isolated. So at the age of 9, Jamie was now Jay. He went through several name changes, one of them being Rocky, which we never bought into. So now he was in 4th grade, and it was the end of the year school trip to Lake Murray that children who had turned in all of their assignments for the year earned. When Jay woke up that morning, he had a pretty bad elbow bleed, so I didn't want him to go on the trip, but he insisted that he would be very careful, and he had worked hard to earn it. So we factored up, and off he went. Dave and I both went to work, and in the early afternoon, I got paged over the loudspeaker to the phone. I knew something was terribly wrong, and when I answered the phone, it was his elementary school principal calling to inform me that there had been an accident on the field trip. I nearly lost it before he could assure me that Jay was fine, and in fact had been instrumental in saving a young boy from drowning. Jay had been playing in the water when he saw his friend Caitlin thrashing around in the water and screaming for help. He immediately swam over to her, thinking that she was having trouble, but she was trying to get attention because there was a little boy that was under the water and he wasn't breathing. They both began screaming and working together to try to get the boy to shore. Jay ended up having to carry him up to shore before anyone heard their cries for help. Thankfully, a father performed CPR and was able to revive the little boy by the time the rescue squad arrived. But even with that elbow bleed, he was able to make a difference in that little boy's life. When Jay was 11, he developed a target left knee joint. It bled often and seemed to be getting worse and worse. It was always large and swollen. So rather than being embarrassed about it, we would draw faces on his knees, and he ended up naming both of his knees. His large knee he named Bob, and the smaller knee he named Bernice. So when we would be, especially at hemophilia functions, he would say to people walking by, "Hey, do you want to meet Bob and Bernice?" And then he'd pull his long shorts up and show Bob and Bernice. Eventually, everyone agreed that Jay needed a surgical synovectomy. We had high hopes for the surgery, but physical therapy was very difficult with the inhibitor. He never got a great return of mobility in the knee and was never able to ride a bicycle again. But the bleeding did become less frequent for a while. As a family, we've always tried to advocate for hemophilia, especially hemophilia and inhibitors. And in 2008, I had the opportunity to start the Great Lakes Inhibitor Support Network for families affected with hemophilia and inhibitors. I had a lot of support from the Northern Ohio Hemophilia Foundation, Novo Nordisk, and my local hemophilia treatment centers in Ann Arbor and in Detroit. I was the chairperson of the event for 5 years before I stepped down due to family obligations. We also tried to teach the children to advocate, and we would include them on the annual Lansing Day that the Hemophilia Foundation of Michigan organizes each year. Each of the kids have a passion for bleeding disorders and has become an advocate for the community. It's been important to Dave and I that the kids learn to become as independent as possible. It gives them confidence and greater freedom. It's been a great challenge for Jay to become independent with his factor. He's had to get so many infusions due to the short half-life of his medication that his veins aren't very good. Once he became fully independent with his infusions, it opened up a whole new world for him to go and do things. Even when he needed to treat 4 times a day, he could still go and have sleepovers and participate in things. So this was our family in 2009. It was that year that we received an email from Lori Kelly that went out to 3,000 of her closest friends. It was a short note telling about an 8-year-old boy with hemophilia living in an orphanage in China. The email said that he was very fragile and he needed a family. Dave and I couldn't stop thinking about him. What if Jay was in a place where he didn't have medication or have a family to advocate for him? We decided to see if there was something we could do to help, donate money, send a care package. So we contacted Lori, and she referred us to the adoption agency that held his file. I spoke with a woman named Pam Thomas, and she told me about meeting this sweet boy when she visited China. She said he was in bed and very frail and weak. He spent much of the time in the hospital and really needed a family to adopt him. By this time, I was crying. I thought our family was complete, but how could we ignore this little boy? Pam told me that she would email his file to me, and then I could contact her and let her know how we wanted to help. The next day, we received his file, including 2 photographs. As soon as we saw the pictures, I knew what I thought we should do. Dave and I talked for several days in hushed whispers, trying to figure out if it was something we thought we could really do. Once we were sure that we were both on board, it was time to talk to the children. So at dinner one night, we showed them the picture of Lu Fong and told them his story. We said we'd like to help him, but we weren't sure what we should do. Anya immediately said, "We need to adopt him." Then Isabella looked around the table and said, "We have an extra chair at our table, so yes, we should bring him home." We told the children that we all needed to keep talking about it and really make sure we were ready to grow our family. About an hour later, all 3 of the children came in. They had had a meeting, and they had decided that we needed to adopt Lu Fong. So we asked them, "Well, where will he sleep? We don't have another bedroom." And they said, "We've already figured that out. The girls are going to move to the big bedroom and share it, and Jay's going to move to the little one, and Lou can have the 3rd bedroom." So the next morning, we jumped in and we began the process and moved as quickly as we could to bring him home, traveling 9 months later. We met our son January 25th, 2010, and he became ours. We had intended to keep Lu Fong as his first name, calling him Lou for short. That wasn't going to fly. First of all, we were told calling him Lou was not appropriate. Secondly, he hated the way we said his name. It was very feminine, and try as we might, we could never get it quite right, and he would be horrified at the way I've said it here today. So we had multiple translators come and tell us he doesn't like the way you say his name. So when we were traveling to the last official thing that we had to do for his adoption paperwork, we were on a bus and all the families were traveling together, and I just kept thinking, what are we going to do about this? So I was thinking about the names of other boys in our family, the cousins. My oldest is James, and then we have Matthew, and we have Jacob, and I thought, wow, those are all strong Bible names. So I started thinking, and I came across Luke as I was going through the books of the Bible, and I thought, what about Luke? So I wrote it down on a piece of paper and showed it to him, and he was already sounding things out, so he looked at it and he said, "Luca?" And I said, "Luke." And he looked at me like, okay. So I said, "You, Luke?" And he said, "Me, Luke?" So I'm kind of going, So then he said, "Me, Luke." And that was it. He wouldn't answer to anything else after that, and he's been Luke ever since. So when we got home, I had to go through getting his name legally changed because all of our paperwork was Lu Fong. But while we were still in China, the first day that we had Luke, he walked for a short time and his right knee began to bleed. His knee was much worse than we had expected, and we felt sure that he would need surgery when we returned home. Since there was no medication for him to receive after he started the bleed, we borrowed a wheelchair and began using rice. He had never used a wheelchair. I'm not sure he had ever seen a wheelchair before, and he was so happy not to be bedridden and hospitalized that he loved that wheelchair. So he'd roll around, and so the first night there was a flat tire, so we walked down the street and found a bicycle repair shop, which are pretty plentiful. And this nice gentleman patched the tire for us for, I think, about $2 or something US. And he was pretty intrigued with the wheelchair as well. Then we went back to the hotel room, and we were sitting and talking, and all of a sudden heard a loud boom, which scared me to death. And I said, "What was that?" And Dave said, "That would be the other wheelchair tire," because he had inflated both of the tires when he fixed the one. So he was back down the next morning getting the other tire repaired for a little bit of an inflated price of $3. So when we came home, Luke was diagnosed with severe hemophilia A, and he received his first dose of factor a couple days after we got home. We began prophylactic treatment 2 times per week and physical therapy to rehab his right knee. Amazingly, he didn't end up needing any surgery on that knee. He was able to rehab it with prophylaxis and physical therapy. So since Luke had never been allowed to be active or play outside, everything physical was a brand new experience for him. The first time he went on the swing and my husband pushed him, he was just terrified, and he had hardly pushed him at all. That quickly changed as his body began to grow stronger and he got used to being active. So now he swims, bikes, hikes, runs for exercise, and he rode on the crew team for his high school last year. We're going to go back to Jay for a moment. He graduated high school in 2012, and he was filled with hope and anticipation for the future, just like all high school graduates are. Things have been challenging for him, to say the least. He's had a difficult time getting around his college campus, and he's had delays in finishing his education because of hospitalizations due to uncontrollable bleeding secondary to his inhibitor. So this is our family in 2010, shortly after we brought Luke home, and then the other pictures are family now. And then these 2 pictures, the one on the left is, those are Luke's knees when we first got him in China, and you can see his right knee is quite large. And the picture on the right are his knees about a week before we came here. And as you can see, he's made a really miraculous recovery for that knee. There is slight difference in his thigh muscle size and in his calf muscle on that right side, but you really have to know what you're looking for. And his hematologist will sometimes ask the students that are in there to try and figure it out before he tells them which knee it was. So, is hemophilia a blessing or a curse? So I would say there are blessings despite hemophilia, but sometimes you have to look harder to find them. If someone said that they could cure my boys and all future generations of hemophilia, I would be thrilled, and I would jump at the chance for them. But even when times are hard, I can look around and I can see that there's always someone else that's having a harder time than I am. So I do count my blessings, and for those of us that deal with the plight of inhibitors, day in and day out, hemophilia that responds to treatment would be life-changing. I'm also blessed with a husband who's a hands-on dad. He's there every step of the way with us, and I try not to take that for granted. I'm blessed with 4 children, and I wouldn't have my 4th child if it weren't for hemophilia. If not for hemophilia, we never would have heard about Luke, and he would not be a part of our family. I feel blessed that we have support from our extended family, and we have a great medical team and strong hemophilia community support. I also feel that as a family and individually, we've grown stronger because of the difficulties that we've had to face. And I'm very thankful and hopeful for the future research that's happening for inhibitor research and ways to give access of treatment to all. But we still have a long way to go. For us, the curses of hemophilia that still exist are big ones. They leave families around the world suffering with inhibitors and limited or no access to treatment. My almost 22-year-old son has significant joint damage in his ankles, knees, and 1 elbow due to his inhibitor. He already needs a knee replacement, but walks through the pain every day to delay it as long as possible. The emotional impact of looking toward an uncertain future and having delay after delay because of his physical difficulties is hard for him. Trying to continue to motivate himself and keep trying is a challenge. He worries about the future. Will he be able to walk in another 10 years? So for us, the curse of hemophilia is inhibitors. We pray that a treatment that will work for our son will happen soon. If we could reduce the amount of bleeds he has, it would drastically change the quality of his life. We also pray for access to medication for all people with bleeding disorders around the world. If our son Luke had stayed in China, he would have aged out of the orphanage at the age of 14. He would have been sent to an institution after that to live out the rest of his days in pain and with a life expectancy of around 25 years old. I will continue to advocate for children with bleeding disorders that need forever families, as well as for hemophilia and inhibitors. I want to thank you so much for letting me share my story with you today, and I look forward to our worldwide support system continuing to grow. Thank you.